Thank you, Dr. Oz. During the transition last January, one of the people I was bringing on as a special government advisor was a long-term friend of mine called Jake Levine. And I asked Jake, can you give me an agenda, the most important things that we can do very quickly as soon as we get in there? And Jake called a professor at Harvard named David Cutler, a famous economist who spent an entire career studying the healthcare system and advising reforms. And he posed that question to Dr. Cutler. He said, what is the single most important thing that we could do to improve the patient experience in this country? We could do very, very quickly without regulations and without legislation. And Dr. Cutler immediately said to him, you can convene the insurance companies and get them to voluntarily agree to end the scourge of pre-authorization. And very early on in the administration, we brought in Chris Klump. And Chris Klump, I'm going to ask Jake and Chris Klump to come up and join me. Chris Klump was a very, very uber successful healthcare entrepreneur from Silicon Valley who specialized in healthcare technology. And in building his company, he had met virtually all of the big insurance CEOs and hospital CEOs in this country. And he spent the last several months calling them each up one by one and getting them to agree to this program. And it was an extraordinary effort. I'm so happy for his leadership, for Jake's leadership on this issue. The two of them have been working hand in hand to make this extraordinary day happen. And it's so important for our country because this has been one of the worst things. As Dr. Oz pointed out, 85% of Americans say that they have had delays in healthcare because of prior authorization. And the doctors hate it. Doctors report that it costs them 12 to 15 hours a week filling out forms. Some nurses are spending over half their time dealing with the administrative burden of this. And healthcare is often delayed to Americans. The cost of administration is enormous to our healthcare system, and we're going to be able to eliminate a lot of those costs by what we're doing today. I just want to read you an experience that a very close friend of mine, who's a physician, had with this, one of his many experiences, bad experiences with pre-authorization, and this is all too common in our country. A patient from New Jersey suffering from severe heart failure was transferred to New York Presbyterian Hospital for a life-saving transplant by my friend, the doctor. To survive until a donor heart became available, the patient urgently needed a mechanical heart pump, a device essential to sustain their life during the wait. The insurance company had approved the heart transplant, but then denied authorization for the mechanical heart pump, deeming it unnecessary. The decision created a perplexing contradiction. The patient was cleared for a transplant, but not for the critical device needed to keep him alive until the transplant could happen. With the patient in the operating room and his life at stake, the medical team was faced with a profound ethical challenge. Should they adhere to the insurance company's denial, which would likely lead to the patient's death, or take action to save the patient's life, knowing it could result in legal or professional consequences? The medical team chose to prioritize the patient's survival. In planning the mechanical heart pump, this decision allowed the patient to live long enough to receive a successful heart plan. My friend, the doctor, was then sued by the insurance company. And ultimately, that lawsuit was dropped. But there are many situations in this country where that ethical decision, for one reason or another, would not have been made, and people lose their lives because of prior authorization. In the past, the insurance industry has made commitments to prior authorization, but they have not kept them. And in this case, we think it's very, very different because, one, the number of patients covered by this is unprecedented. As Dr. Oz said, 257 million patients are covered by the group that we met with this morning. And while we were in that meeting, another company joined the group. And we expect we're going to have rolling enrollment, so we expect many other companies to also join. The other difference is we have standards this time. We have deliverables. We have specificity on those deliverables. We have metrics, and we have deadlines, and we have oversight. So we're all going to be, I'm very grateful to the insurance company for stepping up and the hospital systems for stepping up. We're all very, very grateful to President Trump for his leadership in giving us the impetus to make this happen. This has been something that we have been struggling with in this country for decades. 2 decades of presidents have promised to do this, and none of them have succeeded. Congressman Murphy has been working on this issue for 35 years. And it's a priority for him, and it's been a priority for many people in Congress. And can I ask Congressman Murphy and Senator Marshall to come up as well? So, today, because of President Trump's leadership, we are agreeing to this momentous and monumental achievement. And we hope to see the dividends of this success story immediately materialize as a better experience for the American, for millions, hundreds of millions, literally, of American patients. So I want to thank all of you for being here, and we're happy to take questions. Utilization and the interoperability of the system will allow us, that this is incentivizing, will allow us to do what we ultimately want to do during this administration, which is to begin the transition to outcome-based care, to value-based care. And, Chris Klump walked away from a billion-dollar company in order to join us here, and he wasn't interested in prestige or power or position or salary. He's interested in changing this system, and we have, from top to bottom in this agency now, these people who have come in here who are interested in only one thing, which is to make this system functional, to rationalize it, to make it work, to make our country healthy again. So I'm very grateful to all of you for all the work, Congressman Murphy, Senator and Oz and Jake Levine and Chris Klump and all the many people at this agency who have made this happen. And I'm very, very grateful to the insurance CEOs for stepping up today. It was an extraordinary meeting. It was filled with people who were not complaining. They were welcoming this opportunity. They were showing their idealism, showing their belief in this country, showing the idealism that got them into this industry of healthcare in the first place, and they feel that they have an opportunity to really transform this system in a monumental way that people have been fighting for years, and do it without regulation, without government intervention, but doing it because of the goodness of American business. And that was a very, very encouraging thing to me, and I'm very grateful to President Trump for the leadership that has inspired people to take these kind of steps with faith in our country and faith in our future. Thank you all very much.